This segment of DelmarvaLife is sponsored by TidalHealth.
By now, you have probably heard October is Breast Cancer Awareness Month. Now, it's a time to raise funds for research, spread the word on early detection, and the ever-evolving methods of treating the disease. Now, if you have not been personally affected by breast cancer, well, you might have some misconceptions about the process of diagnosing and then treating it. So how about if we learn that together? With us this afternoon is Dr. David Seckler with the TidalHealth Breast Cancer Center. Thank you so much for joining us today.
Thank you for having me.
Wonderful to talk to you. So can you walk me through the basic diagnosis of breast cancer?
So most of it usually starts out where the patient's primary care provider will recommend that the patient get a mammogram, just a screening mammogram. And what we're looking for would be subtle changes in the picture of the breast tissue that would indicate there may be a developing problem there. And so that then leads to further investigation, sometimes with further mammograms, ultrasound, and then if there's still a suspicion, then a biopsy with a small needle to diagnose that.
Now, I know it's been talked about a lot for the last several years. What are the current recommendations for getting a mammogram?
Yeah, so we still strongly encourage women to abide by or follow the rules that were put out by certain societies. The most common is that at age 40, women should start getting mammograms. We talked earlier, one of the exceptions to that is if there's a young family member in that patient's family who diagnosed with breast cancer, we tell them to start 10 years younger than that. So if a 45-year-old woman in the family had breast cancer, then we would start at 35 for the remaining family members.
So it's important to know your family history.
Exactly.
So you're a surgeon. As a surgeon, are there different types of cancer? Is there one that you see more often than another?
So we're seeing a lot more earlier stage cancers now because of screening. That's the whole point. We're trying to find cancers at a smaller, earlier stage and can be treated more easily. So one of the ones we're finding now is one called DCIS, which is a very early contained breast cancer, labeled stage 0 breast cancer to emphasize that. So we are seeing a lot of that by means of early detection. And then there's others, obviously, sometimes unfortunately we find things at a higher stage that requires a little more treatment, in-depth treatment. So.
We were talking earlier before we got started here, and you had mentioned that you've got a team. When it comes to a breast cancer diagnosis, how does your team work together to come up with a plan for this situation?
So here at TidalHealth, we follow nationally accepted guidelines. We meet every week as a group, a surgeon, a medical oncologist, a radiation oncologist, pathologist, radiologist. We all gather together Thursday mornings and we discuss newly diagnosed cases. So that helps give us a plan where there's a consensus and we're using guidelines that are put out through national societies. So we incorporate all the latest technology, information, data, and research. So yeah, we're very state-of-the-art, and that's how we provide the best care based on what we know from research and data.
So surgery itself, how big a part of the entire treatment plan is that?
So I would say almost every patient with breast cancer at some point meets with a surgeon to perform a surgical removal of where the tumor is.
Right.
Most of the time, surgery is the first part of treatment. We're catching things at a small stage, small size, surgery to remove the tumor. And then following that, there's additional technologies that we apply. Sometimes it's radiation, sometimes it's oncology with chemotherapy drugs, based on what we discover at the surgery. There's some exceptions. Sometimes if the tumor is more advanced or a specific type, we actually flip that around, and sometimes patients will have chemotherapy first, surgery second. But a lot of it just depends on the features of the tumors.
Yeah. So again, we were talking, when COVID came around, a lot of people just put off their mammograms, put off the screenings. What would you say to somebody who is still kind of doing, I'm fine, I'll do it next year?
So as I emphasized earlier, the sooner and earlier we can determine there's a cancer developing, we can do so much more and their prognosis is so much better. Yeah. So I encourage women to pursue getting their screening mammograms yearly. There's nothing to be afraid of. It's a very straightforward process. It's not uncomfortable. The team at our TidalHealth Breast Center provide just compassionate care, and they're there to help you through this. And I would emphasize too, men should also be aware of this. We don't do mammograms, particularly in men, but breast exams, self-exams. Right. So encourage men and women both to do self-breast exams.
It's not just women.
Exactly.
All right. Dr. David Seckler with TidalHealth. Thank you so much for sitting down and explaining some things this
Appreciate
afternoon.
that.
Really would appreciate talking to you.
Thank you.